in progress.
Hi all. Here I am going to explain about interaction of X-rays with matter. Once the X-ray is produced from an X-ray machine, X-rays comes out. After collimation, filtration, everything, a proper useful X-ray, when it comes out, what all things can happen to that X-ray? First of all, there may be no interaction. That is, X-ray will just travel like that without interacting to anything when it is in vacuum. Second one is coherent scattering. It is also known as classical scattering, elastic scattering, Thomson scattering. Here what happens is an electron which is present in the space or a matter. This X-ray comes and hits that electron exactly to the outer shell electron. But the energy of the X-ray is too less that it cannot displace the electron, but it will cause a momentary vibration. So the energy is absorbed by the outer shell electrons of that atom, vibrates for some time, and then it comes back to normal position by releasing the excess energy in the form of an X-ray. So in effect, what happens? One X-ray comes, hits, it vibrates, then the X-ray leaves and it becomes stable. But when the X-ray leaves, it goes in a different direction. And this is what we call as scattering, scattered radiation. So in our dental X-ray unit, only less than 5% of interaction occurs in this way. And this is not good for us also, because it can cause film fogging. And this is the picture. That is the incident photon comes and hits the outer shell electron. But electron will have a momentary vibration. And whatever excess energy will be released as an X-ray only. And then the electron comes back to normal position. But the leaving X-ray will go in a different direction. And third one is the photoelectric effect. It is something like a characteristic radiation, what we have studied. In photoelectric effect, the X-ray photon removes the inner shell electron, that is a K shell electron will be removed by the X-ray photon. The energy of the X-ray is too much that it can remove the K shell electron. Then three things can happen, three products. That is, one is characteristic radiation. That is because the L shell electron jumps into K shell to maintain or correct the void. During jumping from L shell to K shell, the excess energy will be released as one X-ray. That is called as characteristic radiation. Then there is a negative ion and a positive atom, because one electron goes out and this gone out electron is called as negative ion and the atom becomes positively charged. In our dental X-ray unit, 30% of interactions happens in this way. Again, this causes a lot of patient exposure. Not good for the patient, but it enhances the natural tissue contrast. Because of this photoelectric effect, you can differentiate high density bone, low density bone, etc. So first step is X-ray comes and hit the K shell electron. Second step, that K shell electron goes out and it is known as photoelectron. And third, L shell electron jumps into K shell, and during that process, a characteristic X-ray is released. Fourth one is Compton Scatter. Here, X-ray photon hits the outer shell electron and changes its direction. It produces two things, that is, three things in fact, a positive atom, a negative electron, and a scattered radiation. So X-ray has got sufficient energy to remove the outer shell electron. So X-ray goes out in a different direction with a low energy. Outer shell electron also goes out. So outer shell electron wanders as a negative ion and atom becomes positive. It is most common reaction in dental X-ray beam. Around 62% of the reaction is in this form, and it causes film fogging and also increases patient and operator exposure. Not good for the patient. And here the incident photon comes and hits the outer shell electron. Outer shell electron goes out as a negative ion. And the rest energy travels in a different direction as scattered photon. And the total atom becomes a positive. Thank you.